Hi all, I'll begin by detailing the participant characteristics. So she's female, 37 years old, she's 152 centimeters in height and 50 kilos in weight. She has a waist circumference of 73 centimeters and a BMI of 21.6. She has no history of structured exercise and no diagnosed disease or physiological conditions. So according to ESSA, she's a low risk category. So from assessment 2, in the physical activity analysis, the participant completed 150 minutes of moderate physical activity in week 1, which equaled out at 543 METs, and in week 2 she completed 180 minutes of moderate physical activity at 648 METs. This included resistance training, sit-ups, walking, and it was all at moderate intensity. So as we can see, she's only just meeting minimum moderate physical activity requirements. Most important is the breakup of physical activity. So she only did resistance training in week 1 and only did walking in week 2 and did sit-ups in both. So we're not sure if this is an isolated coincidence or whether she did any physical activity at all because she was getting monitored. In any case, according to the guidelines, it would be ideal if all of the physical activity was completed weekly. So walking, resistance training, and sit-ups all completed weekly, and this is due to chronic exposure and adaptation to resistance and aerobic exercise. So the participant could be considered perimenopausal, which means approaching menopause. Now, menopause usually happens in the 50s, 60s, but it can happen in your 40s. So we know that according to the literature, bone mineral density decreases after 40, and that brings up the risk of osteoporosis. So this is one of the main risks of disease for this particular participant, and we can see that resistance training is highly effective for hormonal responses, muscle strength, and bone mineral density increase. And it would be ideal if she participated in 2 to 3 trainings per week, and it would consist of 6 to 10 multi-joint and single joint exercises. So we know as the aging process occurs, there's a linear increase risk of cardiovascular disease. And seeing as she's just meeting moderate physical activity requirements, we recommend that she participates in high intensity interval training weekly alongside her moderate aerobic physical activity. So we know that HIIT training has recently surfaced as a time-efficient physical activity approach and can yield improvements in cardiovascular fitness, insulin sensitivity, lipid oxidation, and regulation of hypertension. The PA guidelines also halve from 150 to 75 minutes if done at vigorous activity. And this is done because we know the dose-response relationship exists with physical activity to further lessen risk. So onto the program, I'm just going to talk about self-efficacy, which is defined as one's innate belief in his or her capability to achieve set goals. And it's a cornerstone of effective behavioural change within the world of health psychology. Now, the authors have positively correlated certain techniques to self-efficacy in regards to physical activity. These include action planning, which is detailed planning of how, where, and when. Providing instruction and information, which is greater specification of how to perform physical activity and benefits associated with higher physical activity. And reinforcing effort towards behaviour, the positive feedback on small successes and progress towards behavioural goals. So with this in mind, the following 12-week program strives to provide detailed and personalised instruction on physical activity progression with long-term behavioural change and chronic disease reduction in mind. The program increases in volume by 10% per week. This is only a guide and can be scaled back or exercise selection changed at the participant's discretion or how they're feeling. It includes resistance training, moderate walking, and a high-intensity interval training component each week to mitigate risk of osteoporosis, cardiovascular disease, but also diabetes, depression, and some cancers. Thanks for listening.